people were happy to participate in it. We found that the questions were based on real matters, real things. They were direct questions. They had time to focus on those questions, time to answer those questions, and the information that we gathered was good data.
It was very in-depth, and I think with the questions that they were asking, they are going to get that information because it does affect. They talk about for example how often someone may drink, how drugs being used and stuff. Well, what's the reason why people do this?
That research methodology commanded a lot of respect from the respondents themselves. They realized that it was Aboriginal people delivering this survey. They realized it was Aboriginal people that helped develop the survey. They realized it was Aboriginal people that reviewed the survey results. They provided additional support services because some of these questions were very impactful to the respondents. When you're talking about poverty, when you're talking about homelessness, when you talk about residential school syndrome and the effects that has intergenerationally within the community members, that can be very traumatic and result in a lot of feelings that need to be dealt with after the fact. And that they provided the mental health services, the counseling services, the ability to come back after the fact. If a week later you're still having negative feelings or impacts, that you could come and still receive counseling services. So the whole methodology itself, I think, was very well done, and I commend Dr. Janet Smiley, and I also commend Sylvia Miracle through the Ontario Federation of Indian Friendship Centres for bringing that research to Hamilton, for bringing it to Headache, the Hamilton Executive Directors Aboriginal Coalition, and in turn, they were the ones that said this should be conducted through the mandate of the Aboriginal Health Centre de Droit de Desne.
It's really important as an Aboriginal Health Centre that we have self-determination and autonomy. And it's very important that we're able to use this report to better sustain our future through supporting our children as they grow and they educate themselves within the healthcare sector. And also in a culturally sensitive way so that they can bring back to their people the values of the culture and to better support our community as we move into the future.